Hello, hello. We are going to go through oral health care today, which a lot of this is probably common knowledge for a lot of you guys, but what you probably don't fully understand is the significant relationship between the oral microbiome and the gut microbiome. So, working together at healing the gut, we always want to talk about oral health. This is something that I kind of picked up on as a nurse practitioner in the clinic. Like, there's got to be a link between some of these chronic diseases and oral health when we think about like socioeconomic status and teeth and access to dental care and things like that, and some of the chronic disease that we see. So we're going to go through that today, and I hope that it is informative. I have some slides to share with you all, so I'm going to do that right now. This shouldn't take us too much time to get through. Some of it you're probably very familiar with. But I think you'll find it fascinating just how significant the connection is. So when we talk about oral health care, we're talking about a journey to not just a white smile or a pretty smile, but a healthy smile. So let's go through just some optimal oral health stacks, I call them. And a few of these you're probably really familiar with, and a couple of them you may not be as familiar with. Some of these I didn't really know a whole lot about until I actually started studying functional medicine. So first, biofilm control is really the foundation of a healthy mouth to manage biofilm. And biofilm is that film of bacteria that can form on your teeth and gums and tongue. And this is where like all the fascination with the tongue scraping and that sort of thing comes in. Oil pulling is been around for a long time. It's an ancient practice, and the idea is that you use oil and you swish it around in your mouth, and it helps remove some of the bacteria and biofilm to promote oral health. Of course, flossing and brushing are great tools to remove food particles and plaque that can lead to cavities and gum disease. And then having regular dental checkups for just normal prevention, and also just a professional cleaning. So when we talk about the importance of oral health, remember that there is a direct link between what is in the mouth and the ecosystem here from a microbiome standpoint, and then to our gut. So we chew here, we swallow saliva all day. That goes directly to our GI tract. So you see how the connection is pretty powerful. So it's more than just bright white teeth. A healthy mouth is essential to overall health. And of course, being confident with your smile that affects mood and that sort of thing. So poor dental health consequences, we know, like I said, it does impact overall health. It increases your risk of heart disease. We know that there is a direct link between teeth and plaque and the oral microbiome and the heart. This is why a lot of times if you have had like, we don't do it so much anymore, but if you, for a while, like if you had any sort of heart murmur, you had to take antibiotics before teeth cleaning. If you've had a joint replaced or a heart valve replaced, you still have to do that antibiotic prophylaxis. So we do know that there is a direct link between the mouth and the heart. Contributes to diabetes complications and affects digestion and nutrition. So kind of going through oral care, obviously brushing is going to remove food debris and plaque. Flossing is reaching the areas that the toothbrush cannot. Mouthwash is going to reduce bacteria, freshen breath. We want to make sure that we use good kinds when it comes to this. I highly recommend downloading the Environmental Working Group, the EWG app, and look up toothpaste and mouthwash on there. It'll tell you good, clean options for that, and then routine dental checkups, early detection and prevention. So when we talk about the oral microbiome, it really is a tiny world, but there are more than 700 bacterial species that we find in the mouth. Some are beneficial, some are harmful. We want to make sure that there is a balance, the same way that we look at the actual gut. It's a hidden ecosystem, and I say this, you guys who have done gut testing have probably heard me say about your gut like it is an ecosystem. It's a garden, it's a forest, and the mouth is like a small version of what we see in the gut. Benefits of a healthy microbiome, obviously oral health for strong teeth and gums, reduced inflammation. And remember that That's something that plays a big role in heart disease. For so long we've been told like cholesterol, cholesterol, cholesterol. But what we know is that there is actually a really significant inflammatory component to heart disease. So reduced inflammation is always great. Whole body health and just the impact that it has on the immune system and disease prevention, so protecting against chronic diseases. So some of the factors that affect microbial balance would be poor oral hygiene. Say that 5 times fast. So neglecting brushing and flossing leads to plaque buildup. Smoking, obviously not great at all for your mouth, for oral health. Harmful chemicals and smoke particles disrupt this balance. Pregnancy. So a lot of times we'll see more cavities in pregnancy. That's something that like I went my entire life without a cavity. But when I was pregnant, I developed cavities. So hormonal shifts can increase the risk of gum disease. And then obviously dietary habits, excessive refined carbohydrates feed harmful bacteria. So it's not just sugar's bad for your teeth, gummy kind of stuff is bad for your teeth. It's really thinking about refined carbs feeding bad bacteria that then affects overall oral health. And that's something that you can talk to your kids about. So understanding biofilms, we have a sticky surface, and that just comes from eating food, obviously like sugar, that kind of stuff, but not just those things. It can create a home for harmful bacteria. It is a complex structure, so it's made of a lot of different types of bacteria. It's not just one. And then the bacteria attach and grow into a community. So it starts to like form more of a community and become a little bit more sophisticated in what it looks like. When we talk about plaque, there are several microbes and they form a complex community. It adheres to teeth and other surfaces. These are the things that having those dental checkups, letting them give you a professional cleaning, that can be really helpful for plaque. The impact of biofilms, ideally the teeth are a non-shedding surface. They form quickly, sometimes in less than an hour. I don't know if any of you ever feel like you get this like overnight. It can really, I mean, it's crazy to think that it can form in an hour as far as time. Like it does not take long. And it can contribute to chronic infections. So the effects of biofilms on oral health, these are more the things like you're going to see. Halitosis, so that would be like bad breath. Gingivitis, which is inflammation and bleeding of the gums. Anything that ends in itis is going to be inflammation. So remember that, overall, just from an inflammatory standpoint, cardiovascular disease, sinusitis, gingivitis, periodontitis, all of these things can be linked. And then periodontitis is actually gum disease, bone loss, and tooth loss. So we want to prevent those things. The connection between the mouth and the gut. So we have the oral microbiome, a complex ecosystem of microbes, and then we swallow that saliva, which transfers the oral microbes to the gut, and then the gut microbiome impacts overall health. So there's obviously a direct connection. So building an oral health stack, these are some of the things that we recommend. Being on a toxin binder does help promote a healthy oral environment. Those of you who are doing any sort of gut work are probably on a toxin binder. Ultra binder would be one of those. Maintaining a healthy balance in the oral microbiome. This goes back to brushing, flossing. Again, I recommend downloading the Environmental Working Group app. When we get into talking about like toxic exposure and toxins and things like that, I want to make sure that you're using a good toothpaste and mouthwash. So download that app and you can actually search toothpaste, mouthwash, and it'll bring up clean, non-toxic versions or options, I should say. Dietary changes, so eating a diet rich in fruits, vegetables, lean meats, whole grains, limiting processed carbs, simple sugars, those sort of things are going to help. Brushing and flossing twice a day. I always say that I will never tell you to do something that I don't do. I do not floss my teeth twice a day. That would be great, and I would love it if you had time to do that. But I think brushing twice, flossing once is okay. And then regular dental checkups, which obviously that's very important. So different oral health products, obviously toothbrush, toothpaste, floss, mouthwash. Again, look up the Environmental Working Group app. That's going to give you some advice here. I will say, like, I am not a dentist, but I really highly recommend the Oral-B toothbrush because it has a round head and can get in some tighter spaces than like the Sonicare and some of the others. And then just when we're thinking about additional oral health products, I really love the Native brand. I actually use their deodorant and a lot of other personal care products, but oral health goes beyond just brushing and flossing. You can consider using the tongue scraper, dental floss, and then mouthwash. And again, don't just go get Listerine off the counter, please. Look up the Environmental Working Group app, but Native is a really great brand when you're searching for personal care products. And that's something that um, for those of you who have done like DNA core and we've looked at the detoxification profiles, I really look at replacing some of these cleaning products, personal care products with better options, but it's not like you need to like go through your bathroom and throw everything away. Just as you're replacing things, we like to choose better options. And this is something that I've really focused on in the last year, making a switch. Here's the Ultra binder. Some of you are on this one, some of you are on biotoxin binder, even Fiber Absorb X or any sort of charcoal binder. And when we're doing gut cleanup, it helps bind to and eliminate toxins. It does the same thing from an oral health standpoint. So it removes toxins and harmful substances. It's formulated to neutralize and bind to potential harmful bacteria, viruses, and toxins. It does help maintain a healthy microbiome balance and reduce inflammation. So those are that's helpful. Typically, I'll leave patients on it when we're doing gut cleanup for 3 to 4 months, and then it's the kind of thing where we can do it just kind of like as maintenance periodically, but it's not really something that you need to be on every single day, like super long term. We want to focus more on brushing, flossing, and the regular dental visits, and obviously watching what we're eating. So I hope that was helpful, and we'll move on to the next module.